Dr. Lucky, thank you so much for coming on the show today. I absolutely loved your book. And it's unbelievable how much, even as a mother, that I don't know about getting pregnant and what is involved. So thank you for coming on today.
Thank you for having me. And I feel so honored that you read my book. I think it's a book that everyone can benefit from because, there is such a need for support for people that are trying to get pregnant. And so my hope is that it's not just the people that are trying to build their families or educate themselves about their bodies, but also their support system, their circles. I hope that everyone gets more educated about this topic because then it will be a more sensitive and supportive environment for everyone.
Absolutely. And my audience ranges in age. So there are going to be women who are in their 20s or 30s who are going to be thinking about conceiving or even in their 40s, early 40s. And there are moms like me. I have a 17-year-old, and there's grandmas. There's women in their 60s who have kids. And so I think the more knowledge you have, the more power you have, and the more agency you have.
Absolutely.
Yes, and that's what we want to give the women listening with today. And one of the things I like doing is reading the dedications because I think it tells a part of the story. And I thought it was beautiful that you dedicated your book to your daughters, you acknowledged your husband, and then you said your patients and those who are going to embark on their journey where no one feels lost in their journey to parenthood. This book is for you. I thought that was so beautiful, but I wanted to ask you in your words, why did you decide to write this book and what impact do you hope it makes?
I wrote this book from the thousands of conversations that I've had with my patients sitting in this very office across my desk and just seeing that there's such a knowledge gap and there's so many people in very, very different situations. But the one common thread is the vast majority of people that I talk to don't have the fundamental knowledge needed, just the basics to really feel like they have agency and that they're in control and can make informed decisions. And so much of what I do, I spend all day talking. I mean, the worst thing that can ever happen to me in my career on a particular day is me losing my voice because I am an educator first and foremost. Before I do anything with my hands, it's conversation, talking to someone, understanding their story, putting the puzzle pieces together, and then spending a lot of time doing the majority of the talking and explaining and drawing. And it's almost like health class 2.0. And everyone is at a deficit when it comes to the knowledge that they need to have. And so my hope in writing this book was to give people a level playing field and to bring them all up to speed and understanding how much that can give people power and control in a situation that is largely out of our control, hence the
Mm,
name the lucky egg, right? There's so
yes.
much you can't control about your fertility and your health in general. It's not always the case that the input of effort and energy and focus is necessarily going to translate into immediate results. That's just not how our health and our fertility work. So I think giving people a really proper understanding so that they can keep their eye on the prize and they can understand what the statistics are and what actually makes a difference versus what probably isn't proven and is a waste of time, a waste of money, and
Mm.
something that might take them on an unnecessary detour. And when I have conversations, I take a full hour with every new patient that I meet. I see the change in their body language. They
Mm.
walk in feeling apprehensive. They're not sure what I'm going to tell them.
Yeah.
And there's a lot of fear and anxiety. And they walk out feeling very much sure of what their next step is going to be. And I think that's all you really need to figure out is like, what is my next best step? And I think compartmentalization is a really wonderful thing in my field because otherwise it can feel like this insurmountable, obstacle to overcome. And it can feel really overwhelming.
Absolutely. And you say you teach Health 2.0. 1.0 was not even an education, right? And it was all centered around how not to get pregnant. And
Correct.
there was, I mean, I had my daughter at 38.
Yeah.
Thankfully, I didn't have trouble getting pregnant, but I had miscarried at 30, like a few months prior at 37.
Yes.
And I, again, didn't have trouble conceiving, but there's so much I didn't even understand. And when I read your book, I was like, oh my goodness, I'm so grateful that was my journey. I mean, she still was a preemie and in the hospital in the NICU
Yeah.
her first 2 weeks. Like, you don't know what's going to happen on your journey.
Yeah.
But this information is so vital. So let's dive into this 2.0 so everyone can learn some of this fundamental stuff. Um, you say that we are taught to prevent pregnancy, but there's so much we don't understand about how to get pregnant. So let's give some of that foundational understanding, like conceiving,
Yeah.
like what's happening, what that window is, because I also didn't realize like how many eggs I had at that age. I had like no concept. I might have
Yeah.
tried earlier had I known that.
Yes. Yeah. I mean, we're born with all the eggs we're ever going to have, and I feel like that's one of the more unhelpful facts that a lot of people are told, by society, like time is running out.
Yes.
But there's not enough context to help people understand, like, why is that important? When did these changes start setting in? A lot of people think that they fall off a fertility cliff at age 35, and that's not actually true. There are plenty of women, including you, it sounds like, who
Yes.
don't necessarily need the help of a fertility doctor, even in their late 30s. Some people in their early 40s, you still have the ability to ovulate a healthy egg, but you're born with a finite number and you don't have the ability to make new eggs or repair your eggs.
Mm,
So both the quantity of how many you have to work with starts to more rapidly diminish as we enter our late 30s and beyond. And more importantly, the ability to randomly, like a lottery, ovulate a healthy egg starts to become few and far between and less common. And you start to see it take a longer time for people to get pregnant because every month, think of it as you have a bunch of eggs that kind of are vying for who gets to ovulate, but it's not a meritocracy, it's a
mm,
lottery. And one of
really?
them randomly gets chosen, and then the rest of the other ones that were kind of in the running die off. And then a new set of recruits comes up to bat the next month. But that one egg is your one shot to get pregnant. And
Wow.
it only lasts for 12 to 24 hours waiting around in the fallopian tube. Ideally, it should be met by sperm sitting there. So, this is why timing is so important because sperm will last for 3 to 5 days in the reproductive tract. An egg will only last for half a day to a day at the most. So, overlapping that window of opportunity means really concentrating your efforts in the 2 to 3 day window in the lead up. Some people say 5 to 6 day window, which I think gives you a healthy buffer. But
Yeah.
really, it's that wanting that overlap between sperm and egg, and that's all you can do. And I talk about it in my book as like a slot machine. Yes, you can make the conscious decision and the effort to pull the lever, which
Yes.
is basically timing your cycle and timing your attempt around your ovulation. But whether the egg gets fertilized, turns into an embryo, whether all the icons that you're looking at on the slot machine line up randomly, that's so out of your control, right? All you can do is kind of predict the timing and try to control that. But it often takes many shots on goal. And we
Mm,
say human reproduction is an inefficient process. 85% of couples will be pregnant after 1 year of regular unprotected sex around ovulation.
okay.
And if it doesn't happen in that time frame and you're under 35, that's when it's time to really call in the experts and say, let's do some actual tests to see, are there blockages in my tubes that are preventing the sperm and the egg from even getting together? Or is there something going on with the sperm? Because
Right.
50% of couples will have a male factor where there's a sperm quality issue. Checking your hormone levels and looking on ultrasound at the reproductive tract, and doing all these tests can identify a potential cause to work around. But a lot of times the tests might come back all normal, and you chalk it up to the inefficiency of human reproduction and the fact that as you get older, not everyone is going to ever, ovulate 100% normal eggs each cycle. Even in our 20s, any given egg has a 20 to 25% chance of being abnormal as an embryo and not even having what it takes to get pregnant or stay
Mm,
pregnant, right? And that
okay.
increases to about 50% at 37, 38. And 70% of embryos coming from our eggs are abnormal in our early 40s. So
Oh,
it
wow.
can get harder to randomly ovulate that healthy egg we need. And then for everything else downstream of that to go well. And that's okay. That's what it means to be a human being. So it's not meant to scare people. It's meant to normalize it because there are a lot of people that walk through my door and say, I've been trying for 4 months and it hasn't happened and I'm freaking out. I think something's wrong with me. And I explain, there could be nothing wrong. And it's just that you need more tries.
Right. And based on their age is how you determine sort of what the strategy will be. Is that what I'm
The
understanding?
sense of urgency, right?
Okay.
Because if
Yes.
you're 35 and older, you don't want to tell someone to wait a whole year. They might get pregnant on the eighth or the ninth month for sure. But
Yes.
assuming you may want to have more than one child, right? Getting you on the path to pregnancy sooner is in your best interest because takes 9 months to be pregnant. It's going to take a little bit of time to get to the point where you're pregnant, then 9 months to be pregnant, and then you're breastfeeding, you're postpartum. It's actually not advised to have children so close together. There is this idea of a shortened interpregnancy interval, having certain risks that come along with that because your uterus needs time to heal.
Mm,
And so by the time you're looking at it, your timeline, it's usually like 2 years between kids, at the
yeah.
shortest for a lot of people. And so when you're thinking about being 35 and older and how things start moving more rapidly with our egg quality and quantity changing, that's why we say don't wait longer than 6 months. And if you're in your 40s, we say don't wait longer than 3 months.
Yeah, that makes so much sense to me. And when you talk about an abnormal embryo, is that what causes the miscarriage?
90% of first trimester miscarriages are because of typos or errors in the embryo where there's missing or extra DNA, chromosomes,
Interesting.
packages of DNA. And a lot of that is derived from our eggs. Some of it can come from the sperm. The sperm can introduce errors as well.
Mm,
But we have different systems, men and women, right? Men are always making new sperm. So they don't have as many breakdowns in sperm related to aging that contribute to an embryo with typos or errors, the same way it works for eggs because we have no repair mechanisms and we're not making new eggs. But male age is not completely a benign factor. And at the extremes of male age, which for men, it's like, in your 50s, 60s, and beyond, yes, you can father children. But there are things that can affect the health and the quality of the pregnancy
mm.
and the health of future children. And this is something we don't talk about enough.
No, absolutely not. I think we don't have any idea what the contribution or where the risk factors come in, including
Yeah.
from the male sperm. Okay, so that's really interesting. So you're open about the fact that fertility struggles aren't just medical, that they're emotional. I know women who've been through the IVF journey. I know women who never were able to conceive. I mean, what do you say to people who are struggling with that side of it? Because it's lonely. I know I've heard
Yeah.
from friends, and it's a roller coaster and the hope
Yes.
every time. So actually, you know what? Let me take a step back too, because we should probably talk about what IVF is and who and when should come see you, and then let's get to that.
Yes. So we were talking a little bit about the major tests, right? And
Yes.
let's say fallopian tubes are blocked. There's no way for the sperm and the egg to meet on their own, right? Just by having sex, there's no way for the sperm to get to the egg. Well, IVF would be the approach because that's taking the eggs out of the ovaries that you have access to in a given cycle, turning them into embryos by fertilizing them with sperm outside of the body, and then usually testing the embryos, freezing them, and then using one at a time and kind of sneaking it to the top of the uterus and then seeing does it implant. And you'll know about a week and a half later if it worked or not.
Wow.
So that might be something that makes sense to do if you need to work around a barrier. Or if there's a very low sperm count, we know that taking this process outside the body, you don't need millions of sperm. You can take one sperm cell and put it into each egg directly and bypass the normal fertilization process. And that overcomes a lot of male factor infertility. There's also the issue of the biological clock. And if there's an overwhelmingly high proportion of eggs that would result in abnormal embryos and someone's having recurrent miscarriages because of that,
Yeah.
or they're just having a really hard time getting pregnant and we think it might be age related on the female side, we can say, okay, instead of working with one long shot egg that you're ovulating, or more laid back treatment options, like there are pills that you can take called Clomid or Letrozole that give your body the chance or opportunity to release more than one egg, but you're still working within the confines of this very inefficient system. So with IVF, you can stimulate the ovaries with these shots, medication injections for 8 to 10 days to try to get a bunch of those other recruited eggs that normally
Yeah.
wouldn't have gotten to ovulate to mature. And then before your body would want to release them, which is naturally what its tendency is, we would go in and extract them. It's a procedure that's done vaginally while you're sleeping. It takes 10 minutes. It's actually
Oh,
a very
wow.
easy procedure. And we basically drain the bubbles of fluid on either ovary and pick up all the eggs because they're going to get thrown out anyway. So it's almost like salvaging. It's
Oh,
saying, let me
wow.
go in and scoop out all these other eggs that I know weren't destined to go anywhere this cycle. And now instead of working with one or maybe at the most two or three long shot eggs, maybe we have access to 10 or 15 or
Wow.
20. And in a controlled fashion, you can put the sperm and the eggs together cultivate them for a week into embryos, and they're not all going to make it. That inefficiency of human reproduction doesn't magically go away just because you're doing IVF. But now you're able to observe survival of the fittest. How
Hmm.
do they fare in the lab? And you'll see attrition. And if you start with enough eggs, then the idea is that hopefully you'll still end up with enough embryos at the end of the day. And once they're at the embryo stage, which only half of them will get there, there's a lot of drop off.
Wow.
But those are eggs that if you had ovulated, that would have been a month where you didn't get pregnant, right? Once they
Right.
get to the embryo stage, you can test them, freeze them, wait for the results to come back, and you can weed out the ones that either would never be destined to implant or might result in a miscarriage. And you could say, let's work on using these embryos that we know have a high reproductive potential because they have what it takes. They have all of their DNA, their chromosomes. And you take one embryo the following month, thaw it out, and place it at the top of the uterus at the
Wow.
right part of the cycle. And you're basically bypassing all of the ones that weren't going to get anywhere and saying, okay, now in a very focused fashion, I've picked the winner of the bunch. And maybe there's a few others that are frozen for the future and they're not changing over time and your uterus isn't aging. So this is a wonderful option for someone, especially as they're approaching their late 30s, who knows they want to have multiple kids, because
Yes.
it's a form of fertility preservation. And putting one embryo in at a time in this day and age of IVF, where it's tested, has a very high chance of success, a 60 to 70% chance of live birth. And if the first one doesn't work, don't worry, you can try again with the next embryo, thaw out one embryo. And within 3 successive transfers, if it takes that to get there, 92% of patients will be pregnant with a live birth, which is a very high
That's
number.
incredible.
Here's the difficulty. Not
Yes.
everyone has enough eggs that we can extract from one round of effort. And if you
Ah,
start with a low number because you just have less available,
I
it's
see.
easier with all that attrition to end up with nothing. And so when people have a low egg count, they may need to do this more than one time to get enough eggs to be able to have a good chance at making a healthy embryo. Or at some of the, age points, like at 45, you can have eggs, but whatever turns into embryos has an overwhelmingly high risk of having those errors in them. So even though you got to
I
the stage
see.
where you could test, you might not get the answer you want. It might be
Yes.
90% of embryos will be abnormal. And so that's where you hear about people being on this IVF train where it's like they're doing round after round after round because you
Mm.
just never know in each cycle. It's a different random sampling of a limited subset of the total number of eggs that you have that are at the surface. And every cycle is a chance, but it's by no means a guarantee because you still need to, the rate limiting factor for most people is being able to make the healthy embryos. And
Yes.
that can become difficult. And then for some people who are listening to this, they might say, you know what, that wasn't the hard part for me because they may have problems with their uterus. They may have scarring, they may have fibroids. So they were able to get the embryos, but now finding that surface area for an embryo to be able to implant with that same high chance of success that we typically quote, it might be lower for some people, and so there can be a lot of different places where you hit snags and it can be very frustrating in a world where you see a lot of the success stories and triumph over infertility. I think there isn't enough space being held for those people that did try this and
Yes.
didn't get to a successful outcome. And I think that's something
Yes.
we need to be talking about more.
100%. And as you're talking, I can just see how this could be such an emotionally draining and challenging time. It's hopeful, but then also if it doesn't come to fruition, it's devastating. And so
Absolutely.
let's address the emotional side. I do have more questions on the IVF side, but let's actually, because I think this, you're right, not enough people are talking about it because there will be women listening today who went through that path and
Yes.
it didn't result in a baby.
Absolutely. I mean, I think, Jennifer Aniston shed light on this. And sometimes we need a celebrity, someone that we have a parasocial relationship with,
True.
uh, to kind of bring to light really important conversations. And I think it shocked the world to see someone who has all the access in the world because, there can be so many barriers to getting adequate treatment and finding the right clinic and having the insurance coverage to do cycles. That's not something that we should take for granted.
Yes.
It's a problem for a lot of people. But here is this, massively wealthy celebrity who could have done 10 rounds of egg freezing when she was younger. And, the lack of knowledge. And she even said in one of her interviews, if I wish someone told me earlier. And that's heartbreaking, right? Because you're
Yes.
thinking, well, if Jennifer Aniston couldn't get the right information and have access to the best doctors and be counseled appropriately so that she could make the necessary plans to facilitate later success, what hope
Yes.
do any of us have, you know? And I think it was really humanizing for her to come out and share, because I think a lot of people, when they go through this, it's like this deep, dark despair and they don't feel comfortable sharing it. I think the world encourages sharing the happy ending more than, you know, the uncomfortable truth that sometimes that doesn't happen for everybody.
Mm.
And so that created a whole thing online. I mean, I shared a post about it when that headline came out. Anytime I talk about it, it just seems to resonate. And people come out of the woodwork saying, like, yes, absolutely. I went through this journey and it is very lonely. You feel like there isn't a support system for you. And the conversation kind of ends there. And then you're kind of left out in the dark. And I think that's something we as a society need to change. I think clinics need to do a better job. Like, we shouldn't just be telling patients, okay, I'm so sorry this didn't work out. We should be providing them and pointing them to resources to get support if we don't have those resources within our clinics. You know, because it's a really sensitive issue and it's so devastating when people do go through this. And I think it's something that people who are in the thick of it maybe don't encourage the sharing of these stories because it makes them feel scared about their own situation too. And that can be further isolating to the people that have these stories.
Absolutely. A couple of things I want to touch upon that you referenced. Well, first of all, with Jennifer Aniston, I wasn't even aware of her story until recently. And I feel bad for her in particular because her life is so public and there was always the scrutiny that she wasn't choosing to have a baby. It was always so
Yeah.
focused on, which is so cruel and unfair.
I
So
can't even imagine going through all of that and then those headlines coming
yes,
out.
it's so cruel. That is, it's
Yeah.
knowing that is just like, it makes me so sad for her because it's already devastating, as you said, and it's such a sensitive subject. But that's why I'm so glad that you're on today because maybe somebody's going to hear this and
Yeah.
they're going to help their daughter or that young woman who's listening is going to say, "Hey, maybe I should freeze my eggs." So let's actually talk about that. So you chose because I think it was because of your career, you know, you were thinking
Yeah.
about planning and based on what you know.
Yes.
So can you share that? Because I think that's actually
Yeah.
helpful. Like this is maybe something I would have thought to do too. I mean, it worked out for
Yes.
me, but maybe what if it hadn't? So
Yeah.
please. Yeah.
Yeah. So I think that I set out in medical school to have very unrealistic expectations. I knew about IVF. I was very interested in this field, but I didn't know all the ins and outs, right? I hadn't started my specific training in this area. And I had an overinflated view, like many people, about what science can overcome and achieve. And I remember saying, like, even when I was single and hadn't met my husband yet, to my friends, like, I won't be having children until I'm in my 40s. I have lots to accomplish. I had all these like
I
big
love
dreams.
it. Yes.
And even when I met my husband and we were dating, I remember him being an entrepreneur and him saying, like, I have things to do. And I was like, well, I have things to do. I'm going to be in residency and I don't have time. And don't worry, I'm not trying to get married anytime soon. And I even said to him when we were married, because we ended up, things moved along and it was kind of like, well, what else are we going to do? So we got married. And I was still kind of in my training, but I was now subspecial in my subspecialty training. So I'd already like gone through the whole OBGYN residency. And during that time, I had trained him mentally to be like, yeah, we're not going to have kids until we're in our early 40s, late 30s at the earliest. And he was like, okay. Like he's just going along with it. And we ended up getting like a 1-bedroom apartment. We thought we were getting settled into our new married life. And just like half a year into my fellowship training, I was like, I think, you know what, I'm going to get off the pill. And I think maybe we should just see what happens because, like, what are we waiting for? And he was
Right.
like, wait, what? He's like, we
How
just
old were
moved.
you? How old were you then? So,
I was 33,
okay, for
33.
context.
Yeah.
Okay, that's
And I
funny.
was like, I just think that, you know, I'm probably going to struggle and it'll be difficult. And then, you know, I'll end up needing IVF. So like, we might as well just figure this out now. And he was like, what? Okay. And it ended up thankfully not being difficult, right?
Okay.
And so then and I had actually gotten some tests done and had a lower egg count. And I remember being like, oh shoot, now I'm pregnant, which is great, but like now it's in the back of my mind of like my egg count's a little lower than expected for age. And what does that mean now, a year from now or 2 years from now? And maybe I want to have two more kids. So then I started overthinking it. And as soon as I delivered my daughter and finished with breastfeeding, I was like, I'm freezing embryos. Let me
Wow.
just do it, because I also felt extreme overwhelm going back to work. I mean, as an OBGYN in training, I had a 7-week maternity leave after a
Oh my
C-section.
God. Oh my
Yeah.
God. I had an
Yeah.
emergency C-section, so I feel for you. Yes.
Yeah. And so I remember going back to work and being like, oh my God, like I don't even recognize myself. I don't feel like myself.
Mm,
I can never do this for another 3 years. Like there's no way that I'll be in a position to do this back to back. So let me just freeze embryos because that's going to take some pressure off. And
yeah.
that ended up not being as straightforward as I thought, just because my egg count was lower. So I had a cycle that was canceled because of a low response. I had a cycle where I got 2 eggs at retrieval, nothing turned into an embryo.
Mm,
And I was shocked at how devastated I felt by that and how worthless it made me feel,
mm,
how guilty I felt because I felt somehow it was my fault, even though I, as an academic and intellectual in this field, like I should know better. But it just all of the teachings and the things that I counsel my patients with, those messages went out the window when it came to me as a patient. And it was
yep.
like actively fighting those thoughts. And it was a real struggle for me. And eventually I
Mm,
got some embryos, but it took a few cycles of trying and getting there. And then I was like, okay, at least I have those. And then a few years later, I was like, okay, I guess I'm ready to do this again. And we start trying, it's not happening. But I felt calmer knowing I had the embryos. And, after 6 months of trying, we said, let's just use the embryos because that's why we froze them. And thankfully for me, I know it's different for different people. That part was the more straightforward part where the first one worked. And
oh,
that's what the
wow.
stats dictate. And that's what
Okay.
happened for me.
Yes.
But I was no longer worried about, oh my God, what's happening with my egg count because I'd already taken care of that. So that's my story. And it's not like that crazy of a story. There's so many people that have had such winding paths and twists and turns in their journey. I feel like mine was relatively straightforward, but it taught me the lessons that I needed, I think, to be a more compassionate fertility doctor. And it's the reason why I put so much emphasis on mental health in my book, because
Mm,
if I, someone who knew everything there is to know about the process and understand every aspect of the science of what's happening in my body,
yes.
still felt blindsided, still felt self-blame, shame, all of the
Yes.
things that our patients struggle with. I mean, how does the person who doesn't have that backing deal going through this process, with all of the unknowns and the things that can happen? And so I really felt like there was no way to write a complete book without, holding people's hand through it all and giving them the mental health support and just a voice that tells them it's going to be okay and it's okay that you're feeling these things. These are
Mm,
all normal emotions. And I've been through it too, even though I'm an expert.
yeah. And for your patients, they are, I'm going to say lucky, but they are lucky to have a doctor who has been through it, who can be compassionate because you have walked the medical side and you've also walked the personal journey. So
Yeah.
that gives somebody both hope and also some comfort that like you know what they're dealing with emotionally. And
Yes.
even with my daughter arriving preemie, like I carried guilt for that too. I didn't realize that until literally she's 17. A
Yeah.
friend, we were having a conversation. She's like, "You can forgive yourself now." And I was like, "What?" And I'm like, "Oh my God. You're
Yeah.
right. I'm still carrying
Yeah.
guilt about like, could I have done something different? Would she have not spent the first 2 weeks of her life in the NICU?
Yeah.
Like what, like
Yeah.
you just carry the stuff. There's a huge responsibility
Absolutely.
that's
Absolutely.
connected to it.
Yeah, my mom had my brother at 25 weeks, which was like
Oh,
really, really a
wow. Oh,
severe case. He's
yeah.
okay,
Yeah, but that's for
but
her.
he
I said the, oh,
wasn't he wasn't okay for a very long time. For the first 5 years of his life, he spent a lot of time in and out of like the ICU, and it was always touch and go.
mm,
And I just remember all the conversations. I remember people just to my mom's face telling her like, maybe you shouldn't have been working so hard. Maybe you were overextending yourself. And they didn't mean it in a bad way. But I don't know how my mom was able to kind of persist and get through that time, because now I think people have more emotional awareness that you really can't say things like that. Maybe it's cultural too. Like I just remember family members and friends of the family saying, it's too bad if you had known and you didn't do XYZ,
oh
like
my
maybe it
God.
would. Yeah, and it's like what not to say, right? But
Right.
I look at my mom's journey and the fact that she grew up in a time as an immigrant to a new country. She grew up in India, in rural India, with very little education. and somehow made this huge leap of faith, came over, and also just culturally, you know, women, whether you're coming from, immigrating from a different country, an Eastern country, even when you think about how far women have come and our rights have come and our independence, like it's extraordinary to think of all the things she accomplished, given her background and then all the things she faced. I think being a woman is really hard when you're navigating trying to get pregnant
Yes.
and expectations and then pregnancy and the complications that can happen and then trying to raise your kids as a working mom. And I feel so lucky to be born into this era where I feel like there's way more discourse and there are more tools than we've ever had. I mean, I was able to freeze my embryos and take some of the pressure off and make
Yes.
my life easier for myself. But these are things that didn't even exist for the generations before us.
Absolutely. And that is the beauty and the power of this conversation and what we're able to offer the future generations. Like you did, you dedicated the book to your daughters. They're going to have a different path forward, and there's going to be more information, more resources. They're going to be having these conversations that we didn't have. I had a friend who said to me, I got married at 36. My husband and I had been together for 5 years. I just wasn't in a rush. It was like you. I was focused on
Yeah.
career. He's an entrepreneur as well, like your husband. And she said, just you should know that sometimes it takes time to get pregnant and, miscarriages can happen. Had she not said that, I don't think
Yeah.
a light would have gone on. And I was like, oh, wait, maybe what am I waiting for? I'm like,
Yeah.
so we
Yeah.
started at 37, but I don't know what I was thinking, but you feel
Right.
like in your 30s, ladies, if you feel like you have all the time in the world, I think
Yeah.
that's normal. You just do. Like you even
Yes.
said it. You were like, oh,
Yeah.
we'll do it in our 40s, whatever.
And that was me as someone who was a medical student. So I
Right.
should
I
have had
didn't
at
even
least
have
a little bit
that. I didn't
more
even have that.
knowledge. And I see it all the time. And I talk about it in the book all the time. I share
Yeah.
so many like anonymized, obviously, patient stories. These are real scenarios. The person who comes in at 48 on birth control and is like, I don't know, should I, shouldn't I? And I'm like, this is really urgent,
Wait, at
and
what age?
at 48. I've had patients come in their late 40s and they kind of feel like everything is an option
Oh,
because no one
wow.
has really had that conversation with them. And maybe
Oh,
there's a
wow.
part of it that's denial, you
Sure.
know, but I just think absolutely what you said is correct in that what would have happened if your friend didn't say that to you? So that's why
Honestly,
too much is left up to chance. That's what I always
yes.
say. It's like
Yes.
you happen to have a OBGYN that really cares and puts the effort and time into prying and asking you the questions and providing the education, or do you have a well-meaning family member or friend that can approach you in a way that's not going to be received in a negative light because it's a delicate conversation to be having?
Yes.
Or like in your formative education, is it ever going to come up? It's just, I remember it came up the first time for me as a resident. There were some women that were in the same training program several years ahead of me, and
Yes.
they were in surgical specialties. And I remember during a surgery, one of them saying, if you don't use it, you lose it. If you don't, and she said it in such a harsh way. And I remember being like, oh, like that's so negative. But you have to kind of hear certain things in
Yes.
different ways from different people. And it's not in a way that should make you feel anxious or like you're being nagged, but it's information where someone's trying to pay it forward and say, hey, like, I just want you to wise up about this and understand the reality. And for
Right.
me, I had the unique position of being in a field where I was seeing women day in, day out in my training who were the reality was hitting them. And I was
Yes.
recognizing that just by proxy. So I always say, even if I went into a different specialty, like I don't know if I would have made the same decisions. And I don't know if I would have two children now. Maybe I would have, but
Mm,
maybe I would have struggled more. I don't know.
yeah. And that's why you're on today, because somebody's going to hear this and they're going to go, "Oh, I didn't have that friend tell me." I'm so glad that Dr. Lucky did. Any key things you want to make sure so a woman's ready to get pregnant, one to two key things that she should just be thinking about or be mindful of today?
I think the number one thing you need to be mindful of is paying attention to your cycle, right? We talked about the time sensitivity of ovulation. If you don't have a regular cycle, there's no way for you to be able to predict when your next ovulation is coming. And you should not follow the traditional advice. I spoke to someone yesterday who is in her 20s, and she said, I've been trying for over a year, but she only gets a period once every 5 months,
Oh, wow.
right?
Yeah.
Not everyone understands that that pattern indicates that she's only ovulating every 5 months.
Right. We
And
do now because you've
right,
explained it to us, but I wouldn't have known that maybe. Yeah. I wouldn't
right.
be
And
thinking about that.
right. So it's important to understand when it makes sense to just go straight to the experts. And if you don't know when you're going to get your next period, go straight to the experts because
Mm.
someone needs to help you figure out when you're ovulating, how to make sure that you're ovulating regularly so that you have an opportunity to try. Because each try is such a long shot that
Yes.
you don't want to be leaving that up to chance, and saying, okay, I'm just going to accept that I only have 2 tries or 3 times in a year. That's really inefficient. Of course it
Right.
can work out, but it's not a good plan.
Right.
And I think that in general, a very broad thing that extends beyond fertility when it comes to your cycle is we all too often normalize our pain and the suffering that so many women go through with heavy periods, really painful periods.
Yeah.
And a lot of times there can be conditions like PCOS with the irregularity in the cycle, or endometriosis, which is a chronic pain related condition
Mm.
that sometimes can be insidious. And sometimes it's just that women have been told their whole lives that this is just a penance for being a woman. You're going to have pain.
Yeah.
But I always say not being able to go to work or function and being in bed all day because your period is never normal, right? No matter what
Yeah.
anyone's told you. So
Yes.
it's not just about your fertility, it's also about your quality of life, your right to a diagnosis, your right to be listened to and heard when you say that you're in pain and you need relief.
Mm.
Because this is a common prevalent theme for women across the board is that our pain has traditionally not been taken seriously.
So true.
And a lot of us have not been heard. And so I think that this needs to end here. It's 2026. And now we know it's a problem. We talk about it, it's in the headlines. But in order to do something about it, part of that is on each individual to self-advocate and keep a menstrual diary, write down your symptoms so that there is objective data that doesn't sound wishy-washy or subjective. And if you don't get the answers you need, self-advocate, get a second opinion, get a third opinion. Don't rest until you get the care and attention that you deserve.
Thank you so much for saying that. I think I want that to like really sink in for the women who are listening because we do just sort of accept whatever we get sometimes and we don't
Yeah,
advocate and we just downplay our pain. I have a
absolutely.
high pain threshold. Well, maybe we shouldn't be bragging about that. I had a guest on saying like we need to stop bragging about that.
I
So if
agree.
somebody has PCOS or endometriosis or isn't sure, they go to their gynecologist just so I can direct. So who do they see for
I
that?
think
Is that
that's a good place to have a conversation. And I
yeah,
think if you don't feel like you're getting any sort of answers,
yeah.
then you can see a different gynecologist. Or you can go, if you have concerns specifically related to fertility, you
Yes.
don't need to have the gynecologist for free. You can go straight to see a reproductive endocrinologist and infertility expert, which
Okay.
is what I am.
Okay. Yes. Which is okay, which is perfect. Any myths on fertility you want to bust? Anything that
Yes. I
bugs you that's
mean,
out there, the misinformation, please.
yeah, and I think it's really hard to uncouple this idea of a low egg count not being an indicator of infertility. Because listen, even I, an expert, freaked out a little bit when I saw my numbers and was like, oh, now I'm pregnant, which I should be happy about, and I am happy about. But, it's going to be a year until I can do anything about this. And what if my egg count's even lower then? I mean, at the end of the day, the reason why I was worried is because that determines how high yield it might be or how well you might respond to the process of stimulating the ovaries if you're trying to freeze eggs or embryos. And I knew that I
Mm,
wanted to do that. But it is very hard for women who have been diagnosed with a lower ovarian reserve or lower egg count than expected for age to not feel like they did something wrong or that their bodies are broken or that they for sure are going to have infertility, even if they haven't been trying, they don't even have a partner. It's very hard for them to not think, okay, I'm definitely going to struggle. And it is one of those things that you want to treat it like a red flag. It is a good idea to think about things like egg freezing if your count is lower than expected at a young age, because how do we know if it's progressive or not?
right.
Right. But at the same time, we need to have balanced, healthy optimism that there are many women, because we're all only ovulating one egg each time we ovulate. So as long
Right.
as you have enough eggs to be able to ovulate each cycle, your chance of getting pregnant is the same as someone else who's exactly the same age with the presumed same egg quality, because there's no direct test for egg quality.
Yes.
Even if they had a high egg count or a low egg count, it's not really about numbers when you're only releasing or ovulating one egg per cycle. So that
Okay.
is the big one, because there's a lot of, companies, at-home tests that kind of weaponize this fear and say, you should check your egg count because, if it's low. And it's like, yes, there can be benefits to knowing that information. So I'm definitely not in the bury your head in the sand camp. But
Yes.
I think that if you're going to send off that test, it needs to come with the necessary context to be able to really educate that patient about what it truly means. And I wish that more and more women did not panic when they get those results and understand that there's no study that has ever showed that having a low egg count increases your risk of infertility. It might make it more challenging to treat you if infertility arises. And 1 in 6 couples will have infertility, but guess what? 5 out of 6 won't. So we don't always have to think of the worst thing. I think it's
Yes.
important to be informed, but we have every reason to feel optimistic. And it's all about balancing that with realism and not panicking.
Okay, that's so good. And anything that we should be taking into consideration in terms of like the female involved and the male involved? Anything we want to know about
Yeah.
the male side that people aren't talking about, have no clue about?
Well, most people don't realize that 50% of couples with infertility have the male factor. Um, I don't know why that's shocking because it's 50-50,
Of
right? But I think
course.
it's this idea that men are invincible because they always make new sperm. It just feels like it's easier for them. But there can be, two contributions because it takes two cells, an egg and a sperm, to get together. And both partners should really be getting tested concurrently. Both partners should be working to optimize their health and their overall fertility and practice healthy habits and not smoke and, bring your A game because you're both contributing to the potential pregnancy, the ability to get pregnant, the health of a pregnancy, and the health of a future child.
We're coming close to the end of the time. Just a couple things is IVF covered by insurance? Is this like an expensive venture or is
It can be very expensive because it's so high tech. A lot of people think as the fertility expert, I'm the one injecting eggs with sperm and I'm doing all these procedures in the lab. I'm not. I have a team of 30 to 40
wow.
embryologists who have at least 5+ years of postgraduate education and training. They're highly skilled individuals and they're, very sought after. And so you have to pay the embryologist, you're paying for millions of dollars of really high tech equipment and the maintenance. I mean, we have a generator, we have the ability to power everything and keep everything at the right temperature for up to 3 days in the event of a natural disaster to give us enough time to move things, right? There's a lot of infrastructure required. I remember early in my career, my parents and people being like, oh, so when are you going to open your own clinic? It's like, this is one of those fields where you really need to have a solid lab behind you. And that's not an easy thing to just have spring up overnight. There's a lot of
Sure.
cost and investment. So it is an expensive process. The medications are expensive. There's just a lot that goes into this. And thankfully, we're seeing a lot more. I would say over 50% of the cycles, actually, the large majority of cycles at the center where I work are patients who have insurance coverage to go through treatment, which is a market shift from 10 years ago, right?
Thank
10 years
goodness.
ago, 0% of the egg freezing cycles that I helped patients with were covered by insurance. And now it's 50% or more.
Mm,
So
it's hopeful.
it's definitely coming from the private sector because, especially in competitive marketplaces, it is kind of a carrot that is dangled. Like, here are better benefits where you can have coverage for egg freezing or fertility. So I don't know that this is the landscape in the rest of the country. I think it depends on where you live and the
Okay.
types of jobs you're seeking. But even general outside of your employer-based benefits, there is more coverage for infertility. It's not 100%, it's not universal. And one state may have a mandate where all insurance companies have to provide some level of infertility coverage. And there are places where those mandates don't exist. So we are getting better day to day, but there's still a lot of work to be done.
Okay. Is there anything I didn't ask you, Dr. Lucky, that you really want to make sure the women take away from the conversation today?
I feel like we've covered a lot of ground, but I think the overarching thing that I want people to feel after listening to this conversation is you're definitely not alone. I think that we as women are sharing this collective journey of having this really dynamic body and biology. And not everyone has to want to have kids, right? But at some point in everyone's life, if they have the parts that allow for them to ovulate and carry a baby one day, I think it's really important that everyone carve out some time, even if they're not in the right social situation or relationship, or in a position where they could even start trying if they wanted to. I think it's really important to think about what you want out of life. What are your personal goals? I always used to say growing up in my early 20s, like, I don't feel very maternal and I can't really picture myself as a mom. I don't even picture myself like being married, much less a mom. I wonder what that means. And I think that a lot of women go through this like existential, questioning and wondering like what is important to them. There's
Yes.
so many parts to us that are so complex and dynamic, but now we're really the first generation that is on truly equal footing with our male counterparts when it comes to career and education. And so I think while there's never been a better time to be a woman and we have access to all the science, I do think we have to give ourselves a pat on the back for being the first generation that's really had to figure out how to balance this all
100%.
and how to also prioritize our personal goals and our biology while competing in the workplace and doing all the things that we're doing. And I think while there are many, many good things about it, I think we do have to acknowledge that it can be a challenge and there hasn't really been formalized training or a roadmap. And for everyone that's listening to this, that's like, oh my gosh, I'm really happy with where I'm at right now. Like, kudos to you for fumbling your way through it and getting there and figuring it out. And for those of you who don't feel like you've figured it out, be kind to yourself and understand, like, how could you have? Like, I feel like a lot of the figuring it out group, it's like they were lucky. They got the right advice at the right time.
It's true.
They were dealt the right cards biologically, and it's not in your control. So I want people to stop blaming themselves, feeling bad about themselves. I want us to all give ourselves a pat on the back for how far we've come and recognize that there are a lot of unique challenges that men don't have to face. It's crazy that we all have to do this magical 180 shift where we wake up one day and go from contracepting to now I have to care about my biological clock and how to work around it. And I think we're all doing great.
Oh,
We're doing the best with the information that we have. And the key is control the things you can control. And one of the things you can control is making sure you have access to good information.
I've loved this conversation. Thank you for the work you're doing. Thank you for everything you shared today. If the women want to find you and your book, it's going to be on the podcast player. Easy to do it, but give your handles out so they can hear it from you. The website, everything you want. Like,
Yeah. So
yeah,
I have a blog, theluckyegg.com, and it has a lot of really informative long form blog posts and content, a lot of calculators, practical tools like understanding your embryo grades and things like that. So interactive tools that I think are very helpful to people. You can find me on Instagram at lucky.sekhon, my last name. And that's where I still make videos and I try to have a fun time and entertain
you're
people and
fun.
fool them into learning.
You are fun.
Um, Thank you. My book is everywhere that books are sold. So Amazon, Barnes and Nobles, you name it. And it's also it's an Audible audiobook and it's narrated by me, which was a very cool experience. And I'm so glad I did that because it's really my message for everyone. And I hope people will read it. I hope you will DM me your feedback. I'm in that weird zone right now where it's like, I've had my baby and now I'm like, what does everyone think?
Exactly. You did. You birthed the book. It is a
Yes.
birth process. I think that's
Yes.
incredible. You're incredible. So, ladies, the book is The Lucky Egg, Understanding Your Fertility and How to Get Pregnant Now. It is out in the world and this episode will be out. So the link will be there. Support all women. This is how we help each other and empower one another so that there is less struggle, more support, more understanding, less shame, less guilt, all of it.
Yes.
And if they or do you see new patients or
Yeah.
people can find you so we can link your
I'm a
clinic too?
full-time fertility doctor at RMA of New York in New York City.
We'll link
And
that too, because if somebody was in New York, I mean, you'd be the person I'd want to come see. So thank
thank
you,
you.
Dr. Lucky. This has been amazing. It's
Yes.
such an honor. And thank you for the work you're doing to help women everywhere.
Thank you for this opportunity and for using your platform to talk about this really important message.
Thank you.